Good morning. I want to welcome you to the HealthLinks Town Hall for this morning, April 27th, Employer Response and Employee Support through COVID-19. I want to thank you again for joining us for our latest Town Hall meeting. This is the fifth in our series, which is dedicated to providing you with trustworthy information during these challenging times. Employer Response and Employee Support through COVID-19. We all know that the pandemic has impacted all of us and our work. And today we'd like to share a few stories from employers in our Healthy Workplace Network. We're having a few technical difficulties. We have one of our employers logged in. We may be waiting for a second one to join. So we'll see how many in our network we're able to have join us today. We'd also like to hear from those of you participating on today's town hall. This one is a little bit different than some of the other town halls we've had in the past, where we want to hear a little bit about what your workplace is doing in their response to the pandemic and how they're supporting you and other employees. So if you have any questions or comments, we hope that you'll post them questions in the Q&A box and chat message if you're having any technical difficulties, you can use the chat function. We're committed to hosting Monday town hall meetings to provide you and your team with tips and resources to support both yourself and your team. And now more than ever, we are committed to health, safety, and well-being of both workers and in the workplace. Really, we are all in this together, and we know we're stronger when we focus on public health and supporting one another. A little bit about our center. HealthLinks is a mentoring program. We're a nonprofit program that champions health and safety at work. Our mission is to advance worker health, safety, and well-being, and we offer evidence-based healthy workplace certification and advising to help organizations and their teams achieve total worker health, or the integration of health and safety. As a nonprofit program at the Center for Health, Work, and Environment at the Colorado School of Public Health, our experience as researchers informs everything we do. Our center, the Center for Health, Work, and Environment, is one of 6 centers of excellence for total worker health, funded by NIOSH, the National Institute for Occupational Safety and Health, at the Centers for Disease Control and Prevention at the CDC. A few housekeeping items before we get started. Everyone is on mute throughout the duration of this presentation. We want you to use the chat function if you have any technical issues coming up. And if you have questions, either for myself or the HealthLinks program or for our speakers today, use the Q&A box. Those are going to be found on the black Zoom bar, either at the top or bottom of your screen. Chat for technical issues, Q&A for any questions you have. And we will be asking you to maybe talk a little bit about or put in the Q&A box how your workplace is responding to the pandemic. We are recording today's webinar and we will share the link on YouTube. This one does not have a full presentation, so there's a little bit of background about our presenters, but what we'll share afterwards is the recording of today's webinar. So there are no slides to be shared, but there is a survey at the end of the webinar. I'll try and remember as we wrap up that when you close out of your Zoom link, you will be prompted to take a survey. We really appreciate your responses on the survey because it helps inform the Town Hall series and our other webinars. Just a little overview of today's discussion. We do have a moderated discussion, as I mentioned, with at least one employer from our network. And we're going to ask a few questions about how they're responding. It looks like we are able to have multiple members of our network joining. So we're excited about that. So we have a moderated discussion followed by the Q&A that I mentioned. And we really do want to deliver trustworthy information. That's our promise to you during this series. So a little bit about the companies we're going to talk to today. First, we have Fitzsimmons Credit Union. They're a community-focused credit union whose goal is to know their members and provide financial support and assistance. They exist to serve their members, and they've been proudly serving Aurora and the community since 1955. Fitzsimmons Credit Union offers a full range of banking products and services and serves as an alternative to the for-profit banking system, if you're familiar with credit unions. They're owned and operated directly by member account holders. Workers in the financial sector are exposed to a variety of occupational health and safety issues, such as workplace violence from aggressive customers potentially sometimes, psychological stress to meet targets and resolve loan disputes, and physical exertion and ergonomic challenges resulting from prolonged work hours and bank teller workstations. Today, we'll hear more about specifically how Fitzsimmons Credit Union is addressing employees and public concerns over the past few months as we look ahead through COVID-19. A few bullet points on your screen about Fitzsimmons Credit Union. They've been recognized with HealthLinks for 5 straight years, a certified leader starting in 2018. Really a strong leadership team, and I'm sure Cheri will talk a little bit about that, our representative from Fitzsimmons Credit Union. They promote mental health and subsidize counseling for employees. As I mentioned before, one potential exposure and hazard in banking is aggressive customers or just customer service in general. So there is violence prevention and harassment training they offer. They're a breastfeeding friendly workplace and a small business, 44 employees, 39 full-time and 5 part-time in the financial sector. A few of the items or the executive orders and memos that have come out that have been impacting the financial sector in Colorado from COVID-19. I have listed here on the screen. There was we've all been, the one in the middle of the screen, March 25th, the safe at home order is the one that has really impacted all of us in the work we do. But a memo on business continuity and disaster response came out as early as March 10th by the Division of Financial Services. So this is directly related to the financial sector and Fitzsimmons Credit Union. The first governor's executive order on March 22nd to reduce the in-person workforce by 50%. Financial institutions were exempted as an essential service during that order. But then the one that we've all been impacted by, obviously, we've all been impacted by many of these, but the March 25th order ordering Coloradans to stay at home. And now we're talking about safer at home as the extension of that as well. The Secretary of State enact remote notary services on March 30th. And then another one that's relevant to the financial sector is some guidance on flexibility in credit reporting for the CARES Act amendment on April 17th. So as you all know and can see over the last 6 weeks, there's been a number of executive orders coming out that have impacted our workplace. These are some that have directly related to the financial sector. A few notes about the city of Longmont as well, our other organization employer that we're going to speak with today as they talk about their responses, adaptations to COVID-19 and supporting employees. Longmont, Colorado is located along the northern Front Range in Boulder and Weld counties in Colorado and encompasses approximately 30 square miles. The city of Longmont was actually founded in 1871 by members of the Chicago, Colorado colony who settled in the valley. Longmont has been named an All-American City in 2006 and 2018, and one of CNN Money Magazine's best places to live in 2006 and 2008. The City of Longmont's mission is to enhance the quality of life for those who live in, work in, and visit the community. A values-driven organization, City of Longmont expects employees and the organization to operate with certain key attributes, like creating and promoting a work environment where it's enjoyable to come to work every day, treating each other with dignity and respect, and supporting work-life balance. Today, we'll hear more about how City of Longmont is specifically addressing employees and the public concerns over the past few months as we look back and look ahead through COVID-19. A few things to note about City of Longmont and their HealthLinks experience. They've been recognized by HealthLinks for 2 years, a leader both in 2018 and recently recertified in 2020. They have a really integrated health and safety program. So when we talk about total worker health, as many of you know, we're talking about the integration of health and safety. And City of Longmont really embodies a total worker health approach by embedding the wellness program within the safety department. They have large and diverse health and safety committees, and they also focus on mental health and stress management. Much larger employer, so we'll hear a couple different perspectives here. 1,636 employees at City of Longmont. That includes 940 full-time, 17 part-time, 679 contingent, which are contract, temporary, or seasonal workers. And the sector for City of Longmont is public administration. As I mentioned with Fitzsimmons Credit Union, Obviously, City of Longmont as an employer has been impacted by both the governor's executive order in Colorado to reduce the workplace by 50%, but then overriding that, the big one, it was the stay-at-home order in March 25th. Now, what's notable about towns and cities is there's a number of essential services that they provide, and so would like to hear a little bit more from Joanne when we're able to call you up about how you're managing different departments and which ones are essential services and how that's impacting the city and both workers. We all know where we live that things like waste management, obviously police and sheriff department, all sorts of other essential services continue with certain new guidelines in place for how they're operating. So I want to go ahead and introduce our speakers today as well. We're really grateful to have our representatives from both of these employers join us and have been part of our network before. So our distinguished guest and town hall panelist, Cheri Prochazka, is the Vice President of Human Resources for Fitzsimmons Credit Union and has been with the credit union for over 32 years. She's passionate about treating the employees the way we want employees to treat their own team members. Prior to the credit union, Cheri was employed with the FBI, Washington, D.C. and Denver. She enjoys gardening, quilting, and game nights with friends. She has 2 grown children and 6 grandchildren. So thank you, Cheri, for joining us this morning. And Joanne Zeas, I hope I'm pronouncing that correctly. She's the Chief Human Resource Officer for the City of Longmont. And prior to joining City of Longmont in 2015, Joanne held various human resource roles in nonprofit and university settings. Joanne enjoys all aspects of human resource management, but as a former social worker, she has a special affinity for employee relations and working directly with employees. Joanne lives in Longmont and is currently surviving the time of her life, where her 3 college-age students are all home full-time to ride out the pandemic with her. So thank you, Cheri and Joanne, both for joining us today to talk about your specific responses and employee support through COVID-19. I've mentioned to you both that we have some questions for you, but before I launch into the questions, I want to give you just an opportunity to introduce yourself and where you work. So we'll start, Cheri, with you. Thanks for joining us today.
Good morning. Thank you. I'm Cheri Prochazka, and I work at Fitzsimmons Credit Union, as David said. I've been the Vice President of Human Resources for several years now, over 32 years with the company, and I've seen a lot of changes and a lot of growth. I've never seen a change like this, however. So we're all in this together.
Thank you. Thank you, Cheri. Joanne, how about you? A brief introduction before we get into just a few questions. So
hello, I'm Joanne, and I think the first thing I learned from the webinar is that I absolutely need to get a headshot. So thank you for putting up with my crazy picture. It's been a very interesting time over the past few weeks. I think a lot of things that I thought I knew about HR that were total rock solid and never changing changed within a minute. And so it's been very interesting to try to get through, and I'm really proud of the team here just for wanting to make sure that what we're doing is first and foremost taking care of the employees here as well as taking care of the city.
Great. Thank you, Joanne. And I think you're both mentioning things that keep coming up, right? No one has experienced anything like this before, and things are changing really rapidly. So those are really common themes that we're hearing, and even comes across in some of the questions and chat we get. We'll get questions that sometimes conflict one another, or we're doing our best to provide trustworthy information, and we may not be able to respond to everyone's questions and everyone's concerns today, but we're trying to share stories right now so that organizations can hear what you all are doing and they can balance it and bring it to their HR teams as well. So I just want to thank both of you for being here, both really experienced human resources professionals, which really helps us in this time of sharing information with our network. The first sort of theme we want to talk about is current operations. What's going on sort of right now? We talked about rapidly changing things. And so maybe Joanne, we'll start with you. What are the top priorities at the City of Longmont right now? How can you categorize sort of the top things that you're working on this week?
So I think the key thing that we're constantly working on, first and foremost, is making sure that our operations are running. So you had mentioned that there are a number of essential services that we have. And so those essential services are key. We're constantly making sure that we have enough staffing to make sure that those areas are covered. And we're trying to navigate through the testing labyrinth and how that changes on a daily and a weekly basis to make sure that we're testing appropriately, that we keep people as healthy as we can, and that we do have enough of a workforce and a bench strength to be able to get through the crisis and still keep those essential services humming without interruption. So that's probably the biggest thing. And then I would say second to that is making sure that we're taking a look at things from an economic perspective and a budgetary perspective, and making sure that we're caring for our workforce, we're caring for the city, and that we're making responsible decisions to be able to move ourselves forward so we can recover.
Great. That makes sense. I noticed a couple things when I was looking on your website about canceling in-person meetings and events through the end of May. Just a variety of things that City of Longmont are doing. I was just hoping, before we move on to Cheri, can you talk a little bit about like what the testing or what the experience of an essential service person looks like? What's a little bit how you're sort of doing that right now. I don't know if you can give a specific position and what their job might entail this week that's new or different, or how it's been impacted.
So I'd say about 90% of our workforce is covered through our city insurance policy. And so we've been working pretty hand in hand with our insurance provider to look through that. And so some of the changes that we've seen over the past few weeks, when we first started, we were looking at 10 days to get tests back. And we were looking at having a very difficult time getting people in unless they were really at risk of having a life-threatening illness.
Okay.
The first thing that opened up for us was police and fire and first responders. So as soon as that opened up, we were able to get first responders in when they had any symptoms. And that was super helpful because we had, I want to say, about 15 people on the list that might have had a symptom, but really, if they were tested and they were negative, could come back to work, so that we didn't just deplete that department and wear out the people that were here.
I see.
So we got that working. The most recent thing that I had that changed was on Friday, where we were able to open up to all essential workers. So, things like our water operations, our electric department. We still were having challenges prior to last week getting those individuals in for testing. And those are just as vulnerable, I think, in some ways as police and fire would be. So we did get that opened up last week. The other thing that has changed is the time to receive a result back. So we are at this point guaranteeing a result within 24 hours, and in many cases getting it back way before that.
Wow.
So that's a benefit that we have.
Okay.
An interesting thing that we've been exploring and not taken the leap on is antibody testing.
Right.
And we haven't done that because we can't get a guarantee that it's going to tell us what we think it's telling us. So we've held off on that because of that reason.
Okay. Great, thank you for explaining that. Cheri, why don't we move over to you and Fitzsimmons Credit Union. I know we've talked a little bit about increased communications of the leadership team and how in that you're meeting sort of daily with stand-up meetings, but tell me a little bit about what the top priorities at Fitzsimmons Credit Union is today or for this week in your mind.
It's probably our member services and being able to assist the members with their financial needs. A large part of our member population are low income and working, paying, living paycheck to paycheck. And so the loss of any wages or their job has a big impact on their livelihoods. And so we've put together a relief package for members. So we have a relief loan. As long as they've been with us 6 months, they can get a $2,000 loan at a low interest rate. We've extended deadlines for payments. We've waived fees. We're trying to just take the pressure off with what we can do as far as their finances. Okay. Secondly, the welfare and safety of our employees is paramount. We have taken a lot of measures to protect them and ensure that they're not exposed.
Right. Yeah, we talk to me a little bit about, I know you sent a lot of employees home. Are they still mostly working from home? Is that the plan for this week as well?
Yes, we've had over 60% of our staff working from home. They've, been assigned different positions that they normally work, or a lot of them have been assigned to our call center because we've had such an increase in the number of calls. It's been a need that we have. We really only need like 6 or 7 people in our building at one time.
Okay.
Because just for the lobby traffic or the drive-up traffic. So over 90% of our staff could work from home.
Okay. And are you finding people coming in through the lobby and using the drive-up services?
Our lobby is actually closed, but yes, okay. we do have our drive-up is busy mostly on Fridays and Saturdays. And it took a long time to, when you're standing in the lobby in line, there's a distance, maybe there was never 6 feet, but now they're not in a lobby, but they'd be 6 feet if they were. But a car takes a lot of space. So
Right.
when you've got, 30 cars in your parking lot, we tried to, move them around so that they weren't just in one straight line so we could make more use of that space, but they were still out on the street. And so took us a while to get that managed. So
Interesting. Yeah, interesting. That makes sense. Another I know theme, and Cheri, you and I have talked about it, or you mentioned it briefly, is communications and how important communications are at this time. Joanne, can you tell me a little bit about how you're communicating with employees, to let them know where the status of things are at, just in general?
So we've had a little bit more of a coordinated approach than we typically do with communications. We, a lot of times before the crisis, would just communicate as we needed to. So if there was something that came out in regard to benefits, our benefits administrator would send it out. Or if there was an upcoming event, we would send it out and not necessarily think about how much we're sending to a particular department or a particular employee group. What we did as this crisis hit is actually had our public information team come together so that there's individuals from each department that is in one group. And so anything that we need to send out to employees, we're actually coordinating through that public information team at this point.
Okay.
To make sure that we're sending out the most important things and that we're packaging it in a way that we're not just overwhelming people and sending them multiple messages.
And have you gotten a positive response to that strategy?
We have. We did have some individuals that were looking for more personal experience. And so for the past 2 weeks, we've been supplementing that with our city manager. He's been doing Friday meetings from 2 to 3 and then a second session from 3 to 4 over WebEx and being able to communicate that way as well. So I think we're trying different approaches. We do have one person that sends out most of our communications so that people know to look for Sandy. And Sandy's emails are going to have a lot of information in them. And then I think we've been getting an overwhelming response to the city manager Friday sessions. And you would think Friday afternoon, a lot of times in the past, that's when people wouldn't want to be around. But he has a cap, I think, of 120 because of the software. And people are logging in 10, 15 minutes early to make sure they get a spot. And we had to record it and then put it back out afterwards because we are actually capping them and people aren't getting in.
Well, that speaks to another really important theme, which is leadership. But before we talk about a little bit about that, Cheri, tell me a little bit about how communications maybe has changed or ramped up for you and your team and from people working from home.
Because they are also spread out now, we do keep in touch. Managers are really good about bringing their team together using Zoom meetings. We meet as an executive team every day, and we put out a pandemic email and what we've discussed about in our meetings and things that they need to know. We try to be transparent and let them know where we stand and to discourage rumors or talking. And communication is key at this time because we are so spread out and people feel like they're an island out there if you don't keep in touch, and be supportive.
Yeah. Well, and you brought up the leadership team meeting daily. I think you mentioned to me that used to be a weekly meeting that you changed to daily. Is that correct?
Yes.
Okay.
Things are changing so quickly, and they still are. So we felt that it was important that we talk about all the changes. And, when you spread your staff out, you experience things you've never had happen before. So not just technical, but, a lot of different issues that we've had to address. So it's important that we are there for their support and that we try to make their jobs easier that way.
Yeah. Thank you. Joanne, you mentioned, crowded town manager Zoom meetings. We've experienced that at the School of Public Health as well. When our dean has had Zoom meetings, they've been really well attended. I think people want to hear from leadership. So it's either, calming. I think it gives them some directive and understanding of where leaders are at. Do you want to speak any more about leadership at City of Longmont? Has town council taken, up any communications as well? Has it been mostly the town manager?
So I think the city manager from an employee perspective has been our primary point of contact. We actually did do the same with our leadership meetings where we've been meeting daily. And then we have an emergency operations center that has coordinated a call that we had been doing daily. We have actually dropped it down to 3 times a week now. That incorporates not just the city, but stakeholders within the city. So the school district is on that call. Both of the hospitals are on that call. to make sure that we're coordinating our efforts with what their efforts are.
Great. Well, let's shift over. We already talked a little bit about the employee experience, but I want to give a little bit of time to talk about what life looks like for employees. The first question is, actually, I think the more important question is probably, can you give us a little bit of a snapshot about what employees are experiencing right now and how you think as an employer you're addressing their concerns? I know people are experiencing a variety of things, working from home with children or whatever else is going on, but would love to hear just any anecdotes, stories you have about what you've heard employees are experiencing and how you're addressing those concerns. Cheri, can we start with you? Anything come to mind in terms of what employees are experiencing right now?
Well, we've had some employees who could work in the lobby but have requested to work from home because of the small children. There's no daycare, and it's important that they're taken care of as well. So we've tried to we've accommodated all of that. We've got some high-risk employees who don't feel comfortable being at work, and we've accommodated them. And for a lot of these, we've discussed not bringing them back when we feel that people are reopening it, because we're not sure of the safety. I mean, they're talking about this going until we have a cure for this, so or a vaccine. And so we're looking at having them just work from their homes in that way. Some employees have expressed that they can't lose their job, and we have no intention of laying anyone off. We're paying everyone as if they're getting their regular salary, whether they can work those hours or not. Some of the positions that they've been assigned to, we can't accommodate. We don't have work for them for 40 hours a week. So, but they're still getting their paycheck, so there's no loss in income. And although we're paying, there's households who may have, loss in wages. So that's still a struggle.
Yeah. Cheri, you and I talked a little bit about that decision to continue paying people full-time even though they didn't have full-time work. Can you talk a little bit more about how that decision was arrived at or what the leadership team talked about?
Well, I've been hiring people for a long time, and it's hard to bring on new employees, train. The expense of training and recruiting is a lot more than if you would just take care of your employees and keep them on through this pandemic. We value them. We want them to feel like they're contributing. Some may, even though they may not have the 80 hours of pay period, there's still a benefit to us. So we want to keep everyone on through this, and we've also taken steps because there are positions that are member facing or handling cash. And although we have them wear gloves and take precautions in that way and masks and things, they're still at risk for getting the virus. So anyone in that position that's member facing or handling cash, we pay a $500 hero bonus every month. So we want them to know, I know money, you can't pay anybody enough to get sick or to have that risk to get sick, but we want them to feel that they're appreciated. They truly are the front line.
Yeah, I mean, we really appreciate hearing those stories. In fact, I've shared the story about retaining employees through this and the cost of having to train new workers when we come out of this being really difficult. And so, really appreciate you sharing that story. I hope it encourages more. I know that finances are really hard in small businesses right now, but we hope that more employers are able to do what you're talking about. Joanne, let's shift over to you. Are you able to tell us a little bit about, I know there's so many different departments with such a large city, and but have you heard a little bit about what specific employees are experiencing and how you're potentially addressing some of their concerns?
So I think it really does depend department by department, but to me, the overarching piece is communication, because there are things that we never really thought about in different jobs that will put people at risk that never would have before. So a good example of that would be our electric department. There's no way that we can keep 6 feet of distance between individuals when they're working on a call for other safety reasons. So it may be a higher risk for COVID, but they can't do their job safely and handle electric without being that close together. So we've been working with our crews, working with our teams, and just kind of taking a look at what is it that you need to do your daily job. And when we can't mitigate the risk from a social distance perspective, that's the first group that'll get N95 masks, for example, if we can get a hold of them. So we're trying to make sure that we're prioritizing those needs when we can't maintain the distance and have those types of safety pieces. Another thing that was employee driven was cleaning. So because we have so many different departments, when we have an exposure in the workplace, when we have essential personnel in, how do we clean those areas? And we were finding that there were some differences, and people came to us and said, hey, can you help us with this? And so we created a policy, and now we have a citywide response for how we're doing that. So we've really kind of relied on teams to tell us some needs, and then we've worked together to make sure that we're meeting those needs. The community has also been amazing to us. We did a mask drive because we didn't have enough masks for everyone. And we got I think we got 2,000 masks that came in that people had homemade for us and had dropped off to make sure that people were safe. And so we just did a couple of photos with everybody in their mask with a little thank you. And so that should be going out to the community soon. So it's really been a partnership.
Yeah. Well, and I think what I hear you saying in there too, that's interesting, is that communication piece of people giving you information about what their concerns are and being able to respond to them. I know that's starting to happen around our university as researchers, and some critical researchers start to go back to work, and they're piloting certain ways for us to get back potentially on the Anschutz campus. Those of us that are not essential workers are probably going to be staying out of work for quite some time, but it's interesting to hear that you're asking team members to give you their input on what they need to feel safe at work, because with so many different departments, you're not exactly sure maybe all of the intricacies of people's jobs. Whereas at the credit union, Cheri, and in a small organization, you probably fully understand what people's day-to-day routines are and what their needs are. So really appreciate that as well. We're going to move to future operations if we're able. I mean, this is a tough category and question because things have changed so much, even since when I was looking at, orders that have been put in place since March 10th or memos that came out. Obviously, a really rapidly changing environment. Joanne, maybe we'll start with you about what are you talking about? You already talked a little bit about the economic impact of this slowdown, but are you able to give us a snapshot of what you're looking ahead towards, or how you're doing planning for 2 weeks from now, 3 months from now, and what that could look like? What do those conversations look like at City of Longmont, if you don't mind me asking?
So I think it depends on at what level. If we're looking from a financial perspective, our chief financial officer has been in front of that, I think, pretty consistently. He does a presentation to council each week and talks about where we are. His initial forecast was that he was estimating an 8-week stoppage followed by a 9-month recession. And so he did all of his forecasts based on that. And then I think we'll need to adjust that going forward, depending on which direction things head. So we're looking at that pretty regularly. We're also we initially put a travel freeze in place and a selective hiring freeze in place. Not 100%, because there are some positions that we really need to have, either for safety or because it's creating revenue or because it's just absolutely necessary in the community. So we froze most things from a hiring perspective, but we do take a look at them position by position to make sure that we have what we need.
Okay.
And I think we'll continue to do that. We've been asked to take a look at our budgets and see what it is that we do need, what is it that's going to help us continue to move forward, and what are things that we really can hold on. And we're trying to be strategic about that. So a conversation that we had last week was in regard to purchasing vehicles. There was a conversation about, well, that could save a lot of money next year. But then the follow-up to that was, well, yeah, it may, but it's gonna hurt us more in the future. So we're trying to look at it from a holistic perspective.
That makes sense. Cheri, what's going on at the bank in terms of future planning, both economic concerns or talking about operations or reopening? I know you touched on it briefly in terms of safety and safe procedures, but as we look at transitioning from stay at home to safer at home, and as various counties sort of open up a little bit more in early part of May, what are you talking about as a leadership team as top priorities there?
We're going to be kind of a laggard. We're not hurrying or rushing. We've been open all along,
right,
and serving our members, and we're kind of forcing them to use technology and to learn how to use an ATM or get direct deposit. I mean, things like that. So we're hoping that continues. We have over 17,000 members, and we only have about 6 or 7 unique members visiting our lobby every month. So there's a lot of them that learned how to do that. So we're putting together a plan, and kind of changes daily because we keep hearing different things. And so we're going to start bringing our back office back probably first, and continue to just use our Driveup for serving members. But a lot of our back office, we're thinking of just letting them work from home, and, like in the call center, jobs that they don't have to be here. Before this pandemic, we were looking at reconfiguring our lobby, and now we're looking at installing an ITM, which is an interactive machine, teller machine, and a teller can work from anywhere from that, but it's an in-person experience for them. They're not touching or face-to-face, but it's the most, like you were standing at the teller line. And so if we can get that installed, we also talked about putting in cash dispensing machines so tellers don't have to touch the cash. And if once we open our lobby, of course, we'll put the 6-foot, markers on the floor and install hand sanitizing stations. We purchased germ shields to put at each teller station and at the receptionist desk. So that's an extra precaution. We'll require them, our members and our tellers, to wear masks and gloves for the tellers that handle cash. But all this is subject to change because we don't know how long it'll go. We're looking at this as an opportunity to change the way we do business and the way we have member interaction. So this is a good opportunity. Can be a silver lining, I guess. Get the members trained how to use technology and not have to be in our lobby every day to get their lunch money.
Well, I really appreciate you, the asset-based approach that Fitzsimmons Credit Union is taking to this, that we haven't heard many people looking at this as an opportunity. I think any opportunities arise at City of Longmont, Joanne, in terms of efficiencies, or how, obviously, communication and hearing from the town manager is something that people have appreciated. Is there other opportunities that, or things that have come up that have either surprised you or been positive? The community response you mentioned with giving face masks and how generous and supportive community members have been any other opportunities you think have come up?
Technology is jumping to my mind. We actually had a pretty robust technology network because our IT department was assuming people were going to work remote, and somehow that just didn't happen until this happened. So we've been finding that that's been working for us, and I'm expecting that some of that is absolutely going to continue going forward. So that I think is absolutely going to happen. I think just the way people have been interacting with each other, I really hope that is something that continues. It feels to me like people have really kind of bonded together, and it's interesting because you think with technology that you wouldn't feel as close to individuals, but as people are getting work done and somebody's cat jumps on the computer or those types of little things, people are actually, you went to that college, I see the banner behind you in the room you're sitting in, and those types of connections has been very interesting to see start to develop, and I'm hoping that continues.
I hope so too. We've noticed that also, that we've gotten sort of a glimpse inside people's homes. Oftentimes I'll have my 4th grader walking behind me on some of these town hall meetings or some of the other team meetings with our webinars. And so I think people get a little bit more of a sort of look at what people's personal lives look like. And hopefully that translates into deeper and more meaningful relationships with people. This is a point where I want to sort of pause on the questions that I had necessarily and encourage those of you participating. We have over 130 at least people participating on the town hall meeting right now. One, to put your questions in the Q&A box. So down at the bottom of your Zoom screen, there's a little Q&A button. Or also you could share a story about how your workplace is responding, supporting you through this COVID-19 and the pandemic. So the first questions that came up, Joanne, were based on your mention of extensive testing, which I think we're all eager to find out how we can do that, whether that be, live testing or the antibody test. So curious about, how the City of Longmont has been able to get to testing. Is it based on being a city and a municipality, or people are curious how you've made testing available so broadly and been able to get a response so quickly?
I would not say it's broad at all.
Okay.
I think it is within our public safety department. So our police and our fire have access to the testing, and that's because they're going out on calls. They're seeing an average of 3 people an hour. So if we don't have those individuals tested, they're going into those homes. They might be, when there's some sort of a crisis going on, they could be arresting somebody, touching them, all kinds of things. We've had a couple people spit on, just all sorts of issues. So because of that, first responders were really prioritized in testing, and I think that's throughout the state.
I see.
What's been recent for us has been the essential workers, and that's a relatively narrow definition as well, but it's areas like water, wastewater, electric, things where we really need to make sure that those services continue for the community. Very similar to like a grocery type of maybe even more so because it's touching everyone. So if those, if we have 4 or 5 people that go down in water, the whole city may not have water. And so that's been the positions that have been prioritized. But we have a lot of other individuals I've been tracking. I think we have about 60 sick, and I think we prioritized about 8 or 9 of those for testing because of those roles.
And the testing is going on at local health clinics, or?
Through our health insurer. We're part of the Kaiser network, and so they've worked with us specific to the essential workers.
Got it. Thank you for that clarification. I'll ask this question of you, Cheri. How are you dealing with people who are going to be maybe simply just afraid to return to the workplace at all? They may not have underlying conditions or childcare issues at home, but have you had a chance to discuss, or even discuss one-on-one with employees about the fear that they may have as return to work starts happening?
We've talked about that, and we have an all-staff meeting with the Zoom as well, and so we're able to answer questions like that, and we survey after every Zoom meeting that we have, and to test where they are and how comfortable they are. We do have a high-risk employee who came back to work this week, and because she was just wanting to come back, she's a back office employee. We still do the stress hand washing, and we have every door that we can prop open so we don't have to touch doorknobs. We've got Clorox wipes at every entrance where we do have to touch the handles. So we try to make it really safe for everyone in the offices. There are cubicles in some areas, but they're still a partition and 6 feet apart. So I think they feel comfortable. There's only 3 people working on that floor right now, and so in the back office area. So I think that if they really don't feel comfortable coming back, we're not going to force them.
Okay.
We'll find them a project, we'll find them a job to do, but if they're not comfortable coming, we're not going to make it hard for them not to come back.
Thanks, Cheri, for that. Joanne, have you guys talked at all about this, about fear of people expressing fear in their return to work? Once again, it's a much larger organization, so just curious if that's come up.
Not so far. We haven't gone to the larger opening at this point. The groups that we have working right now, and we're probably close to 40% or 50% because of the essential jobs. And so we did have a lot of heart-to-heart conversations with individuals at the very beginning when things shut down, and yet they were still working.
I see.
And so that was actually the beginning of the communication where we talked about, well, what do we need to do to make this as safe as we possibly can?
Okay. So this is a difficult question, but maybe I'll pose it to you, Cheri, and also, are you talking about equity in terms of the risk of people coming back to not? I mean, you've already mentioned that if people don't want to come back to work, you're not going to force them to do that. But has there been any conversation about equity or the risk of discrimination of determining who gets to work and who doesn't? Has that come up at all?
No, I mean, I think we know our employees pretty well. We're pretty small, and we know a lot of their concerns, or family, if they've got small children, if they are high risk, or they're just scared. I mean, we found out a lot of people can work from home and do it very well and be very productive. In fact, today they were saying they actually get more done because they don't have the interruptions and there isn't the chit chat. So I think that we could accommodate that, not for every job, but we could put them in a job that could be accommodated.
Great. I mean, I know that that equity is such a big conversation, and inclusivity within the HR world. Joanne, has equity come up at all in terms of return to work, or in the beginning when people were talking about coming to work or not coming to work? Has the equity and inclusivity conversation come as part of the HR discussion?
It's been there a lot. Before the crisis hit, we were working on a project through the Equity Foundation. So I think it was kind of front of mind with everyone. And so as the laws were coming out, we were actually looking at it and saying, what do we need to do to make sure that we're equitable? So an example of that would be childcare was covered pretty well in the law, but elder care was not. And when you look at who's really at risk for this virus, it's elders. So if you have somebody that's doing elder care, how do you not give them the same thing that you would give somebody for childcare? So we're looking at that consistently as we go through our policies and practices, and meeting the law, but sometimes exceeding it where we feel like there's an equity need.
Well, I really appreciate you bringing up elder care. One of the other comments that came in was really focusing on family-friendly workplace policies and practices. It's a subject matter that HealthLinks as a program has taken a deep dive on. For those of you that don't know, we have a module that's specifically dedicated to being a family-friendly workplace. Now, I will admit that some of the questions on that survey are maybe difficult to respond to given the current crisis going on, but we do hope that organizations like you're saying, Joanne, take a really broad look at supporting work-life blend and work-life integration. It sounds like you were doing that before the pandemic, and now it continues and is sort of an area of focus for you. So being a family-friendly organization is something that you're mentioning, that families are coming first, or communities mind is coming first. So we encourage all of you that are participating to continue to focus on being a family-friendly organization. I don't know if either of you have any comments on that, on being family-friendly and how it's come up in the last 6 weeks or so. Cheri, any thoughts on that?
It's probably come up more in the last 6 weeks than we've had, forever. And it's usually we have one individual who's, I believe her mother is in or grandmother is in a nursing facility, and she's the one who has to administer medication or something. And so she has to go into this facility once a week. She asked that she not come back until everything is well. And we've accommodated that. And then the small children, schools may not even be, in session this fall. I mean, who knows? So we're prepared to manage that. I mean, we're taking one day at a time. We try to accommodate everybody.
Yeah. And I think the other thing we've learned from our conversation around family friendly is every small conversation helps, right? I mean, acknowledging that people have different family situations and understanding that there's differences, whether you have small children, school-age children, adult children that you may be dependent on you, or elder care. Each conversation is unique and different. And I think what you're relaying at Fitzsimmons Credit Union is you're taking all of these conversations personally and able to adapt as appropriate as well, which we really appreciate that comment. Joanne, anything else come to mind for you about being a family-friendly organization, remote work, or how people are balancing the demands of having kids at home?
I did mention to a group last week in terms of remote work, I would say that if we're looking to make strides or advance family-friendly workplace, remote is, to me, the low-hanging fruit. It's something that we might be able to hit. I think, building a child care center right now in the financial situations we are is a little bit of a challenge. I don't know that we're going to make a lot of strides with things that are expensive. And to me, the remote work is a way to try to have that conversation and prioritize things that we have at our fingertips.
Okay. There's been a few questions about whether or not people are losing pay or health insurance benefits. Have you had to adjust at all? Cheri, you said that you're keeping them on. Joanne, have you had to adjust or shift benefits or pay for employees at all?
We have not yet.
Great. That's terrific. What about I was curious with the amount of seasonal and contract employees or contingent workers you had, is there a pause on some of the traditional seasonal opportunities that come up?
So we've continued hiring, but what we've done is we've done our letter with a contingent start date.
I see.
So if that program goes, we want to be ready for it to go. Day camp, for example, if we're able to get that going, we need to have staff in place to be able to do it. But at the same time, we're not able to guarantee that it's going. So that's kind of where we're at.
Okay. Another interesting conversation that came up is people's ability to use technology. Not being the same based on sort of age or your background or whatever. Has there been, has that conversation come up? Maybe Joanne, I'll start with you. Anything come up in terms of people's ability to access technology and any training or help that people have been given in terms of going to more of a remote work situation or the use of technology?
So I think we were pushing that prior to the pandemic. And so I do think we have a decent amount of skills. There are some that are not necessarily as comfortable. Some of those individuals have chosen to come in because they felt that they could be more productive that way. We have not stopped that as long as we've had a low enough group in that workplace to make that safe.
I see. How about you, Cheri? Has there been conversations about access to technology and people's comfort level with it?
We had some hurdles. Our IT department had to scramble and and order like 30 laptops because we didn't have laptops for everybody. And of course, it's at the time when every other business is ordering laptops as well. So it was kind of a hit and miss. But and then getting them set up in our call center, they're actually on 2 different programs. So they're toggling back and forth, and that was kind of an issue. One challenged individual we thought wouldn't catch on, and we had a Zoom meeting, and she was the first one to call in. So I think they want to do a good job, and I think that they want to learn. So they're taking this opportunity to build their skills.
Well, I want to just tell people participating, thank you for all of the great questions that have come up and some of the chats that have come up as well. I want to also thank Cheri and Joanne for joining us today. Once again, it's great to have the experience from an HR perspective, and both of you have just been so positive in terms of an asset-based, in terms of how you're managing through this, which we really appreciate as well. We know that this is challenging for everybody to deal with, but it's been great to have a small employer and a much larger municipality perspective as well. I agree with what Cheri mentioned and how Joanne is mentioning that the city of Longmont community is coming together. We really do feel like the more we share stories, we really are all in this together, and we're going to come out through this stronger with a more of a focus on public health and approach. So I just have a few concluding slides for those of you that are participating. Thanks again, Cheri and Joanne, for joining us today. Really appreciate it.
Thank you.
So as we've mentioned before, we are committed to weekly town hall meetings. Our next one is going to be a really great conversation, a really important one, risk reduction and personal protective equipment by the chair, professor and chair of the Environmental and Occupational Health Department, Dr. John Adgate. So we hope you can join us on Monday, May 4th, same time, 11 a.m. Mountain Standard Time, as we hear from Dr. John Adgate, who, as I mentioned, is the professor and chair of the Department of Environmental and Occupational Health at the Colorado School of Public Health, to learn more about PPE, something that's really been in the news. We've all learned a lot more about personal protective equipment, and including face masks, and how to understand about exposure being both airborne and surface-based, and ways that we can all reduce our risk. So this important presentation will really help us all with some really key information about what we do, both at home and at work, as we all respond to the next phase of the pandemic. So what I want to mention is that as a wrap up to today's town hall meeting, we will send everyone that's registered, whether you were on or just registered, the recording of today's webinar, as well as the link to register for this next town hall. So you will receive that email shortly within the next day or two. Finally, 2 things to note. One, we want you to stay connected with HealthLinks. We have our website here, healthlinkcertified.org. We're also offering free advising sessions for your organization. We're really building quite a network of stories from organizations that are certified with HealthLinks, and we think that these resources will be helpful. So whether you're in the Healthy Workplace Network or not, I encourage you to jot down this email address, contact@healthlinkcertified.org. You can send us an email there if you'd like a free advising session to talk about HealthLinks, our program in general, and how it can be beneficial to you as an employer, or just to brainstorm ideas based on what you heard from our panelists or some of the other town hall meetings, ways in which your workplace can continue to focus on health, safety, and well-being. So our general email inbox, which you can find that email address on our website as well, is a place where you can reach out to us and schedule a brief advising session with myself, program manager, I'm David Shapiro, or our program coordinator, Katie Guthmiller. We're happy to speak with you about ways in which you're adapting and responding to the pandemic. And then our social media channels are listed here for you as well, which is where we're really pushing out the most recent and up-to-date information in employers' response to the pandemic. I will mention, as those of you are logging off from Zoom, that there's a survey that pops up. We hope you'll take a few moments to complete the survey as you exit our town hall meeting today. We use the information from the survey to inform our town hall series. And so, as I mentioned, next week's town hall is about PPE and how we can mitigate risk and through face masks and surface cleaning. But we have other town halls coming up after that as well, including crisis communications, another town hall or webinar on mental health as well, which is so important at these times. But we want to hear from you and what your perspective is on what your needs are. So I'll leave this up on screen. Once again, Cheri and Joanne, thank you for joining us today. Please connect with the Health Links either through email, our website, or social media, and take the survey as you exit today's town hall. So thank you, everybody, for joining us.